have post-polio syndrome. And anywhere from, the studies show anywhere from 30 to 50% of this population complain about dysphagia or swallowing problems. And just in general, throughout the country, we have about 15 million people in the United States who have swallowing disorders for a variety of reasons. How we swallow. So swallowing is a very complicated function. Most of us take it for granted until we or a family member or friend has a swallowing problem. We use about almost 100 muscles to swallow with. These are muscles of the throat, muscles of the tongue. We consider muscles of the shoulders and the neck where you're holding up your head as part of the swallowing system. We use major cranial nerves, which we have 12. We use about 8 of those 12 nerves to swallow with. So it's a very fast process. Once something is in your mouth, it takes anywhere from 1 to 2 seconds at the most for this complicated system to actually work. And part of the system is a reflex. Part of the system you have control over. So I could ask you all to swallow right now. Go ahead and swallow. You can do that. You have control over it. But sometimes, say when you're at the dentist and you have all that saliva in your mouth, automatically you're swallowing, and you almost try not to do that because they're in there working. So, unfortunately, this part is not working, but this is an example of what we're looking at. This is your swallowing mechanism. So you have here's your air pipe, your trachea down to your lungs, your food pipe is back here, your esophagus, your mouth is here. And so that's what we're looking at when we're looking at swallowing disorders. That's the anatomy we're looking at. I won't get too much into the detail of the anatomy.
That little tiny, the food pipe is like this big compared to the air pipe?
Well, your food pipe, your esophagus is actually closed all of the time unless you're actually actively swallowing for it to open and accept the food. So it's this flat it's a little area here, it's flat all the time unless you're actually swallowing. So it's closed.
Okay, why you need to chew well?
So we swallowing nerds break down our swallowing into 4 stages. The first one is where the food is bitten and chewed. Second stage is when you pass the food from the mouth into your throat. Third stage is when the food is pushed through the throat into the food pipe. And the last stage is once the food enters the food pipe or the esophagus towards the stomach. Causes of dysphagia or swallowing problems. You can have your neurological causes, a stroke. A lot of people in here probably know people who've had a stroke and I just had someone telling me about his father and how he had someone else in the facility that he was living in who was on pureed foods, kind of the baby food and the thickened liquids. So oftentimes strokes can cause swallowing problems. You can have progressive neurological disorders such as Parkinson's disease or Lou Gehrig's disease. And then obviously we're talking about post-polio syndrome here, which is a cause. Head and neck cancer can cause swallowing problems. You could have a tumor anywhere in your throat in a swallowing mechanism. That could cause a problem, plus the treatment that's involved with head and neck cancer, radiation, the surgery that may be involved. Medical problems such as scleroderma, diabetes, rheumatoid arthritis. Those can also cause swallowing disorders. And then medication, some of the side effects also can cause swallowing disorders. So post-polio syndrome and dysphagia. So you're all aware that there's a progressive muscle weakness after the initial disease. And oftentimes swallowing problems are due to weaknesses of the muscles of the tongue and the throat and the mouth. And when tested in studies that have been conducted by speech pathologists, about half the clients that were actually having a problem were aware that they were having a problem. So that's why being evaluated and treated by a professional is so important, especially if you just even think that you might be having a problem. So swallowing problems can occur at one or all of those stages I talked about earlier, 1 through 4. There can be some serious consequences with swallowing problems. People can become dehydrated. You could have weight loss, get malnutrition. You could have choking episodes. You could have pneumonia due to aspiration, food or liquid going into your lungs. And it obviously affects your quality of life. You know, being out in public and coughing and choking all the time when you're eating or drinking, you know, it's uncomfortable. You want people noticing you. That's what we do. That's a big part of life, is the socialization around food, around holidays, and holidays surround food. So quality of life issues are very important to us too. Common problems in the mouth, in the oral phase. You can have difficulty chewing the food, preparing the food to swallow, controlling the food. Sometimes the food can either spill out the mouth, spill into the throat before you swallow. Causes of problems in the mouth are muscle weakness, not being aware, having a sensory issue where you don't realize where the food is in your mouth, and some people have impaired cognition, so they're not very aware of how fast they're eating, how much they're putting into their mouth at one time. Problems that can occur in the throat. I talked about aspiration, that I felt like it went down the wrong pipe. Aspiration is when food or liquid actually enters your air pipe down into your lungs. That can be very serious. It can cause pneumonia, breathing problems that we talked about a little earlier. Another problem in the throat, you could have food or liquid left over in the throat. So you swallow one time, but there's food left over. You may feel it, you may not feel it. Again, causes muscle weakness, having your sensation impaired where you're not really feeling that. You could have a structural issue in the throat, or something wrong in the food pipe that's causing the food to back up or not completely clear in the throat. Thank you. So the next stages where you could have a problem is in the food pipe, the esophageal phase. So food and liquid either doesn't pass into the food pipe, food or liquid comes back up from the food pipe into the throat, and this could be due to muscle structural changes in the food pipe. So many people have reflux disease, GERD, or stomach acid, heartburn that comes back up. There could also be muscle weakness, and there could be problems throughout the food pipe that a doctor would diagnose. So aspiration, that's when the food or liquid goes down the wrong pipe. Normally, we cough, we choke, our eyes tear, we sneeze. We show that this is going down the wrong way. In some people, though, that we evaluate, it's called silent aspiration. They don't cough, they don't choke, their sensation is impaired, so they don't feel when it's going down the wrong pipe. Now that could be even more dangerous than when you cough and choke. Coughing and choking is a reflex that we have. It's a way to protect our air pipe. Our body does it automatically. So at least 40%, in some studies up to 60% of the people who have food and liquid going down the wrong pipe don't actually feel it. They're silent aspirators. Again, another reason if you feel as though you or a family member or a friend is having a problem, they should really have an evaluation to be sure that they're not one of these silent aspirators. So symptoms. We talked about coughing, choking. During the meal, sometimes this happens actually after a meal. You consumed a meal and then later you're coughing, you're choking, you complain of mucus or phlegm. That could be a sign that you're having a swallowing problem. Frequent respiratory infections. You have a respiratory infection, you're on antibiotics or pneumonias, gurgly voice, you're losing weight, and you don't really understand why. You could have pain when you swallow, or feeling the sensation of food getting stuck. Problems with your feeling as though you're choking on your saliva. Drooling, fevers, productive green-yellow mucus cough. Those are all signs that you may be having a swallowing problem. Having to swallow more than one time per bite. Normally we just swallow one time, our throat is clear, then we move on to the next bite. But if you notice yourself or a loved one or family member swallowing multiple times with each bite, that may be a sign as well. So our team, the team that manages swallowing problem, obviously you would talk to your main doctor, your primary care physician, tell them you're having a problem that you'd like to be evaluated. So it involves a speech pathologist such as myself, could involve a radiologist at some point if we were to do some diagnostic testing, which I'll talk about. Gastroenterologist, that's the doctor that is in charge of the food pipe, the esophagus. So that might be needed, not necessarily for everyone. An otolaryngologist or an ear, nose, and throat doctor. So they're the doctors that are in charge of the voice box, and they may give us information if you are having a problem that will help us treat you better. A nurse, a dietitian, especially if you're losing weight and there's a nutrition or hydration issue. So swallowing evaluations. An evaluation of swallowing is ordered by your doctor. It's performed by someone such as myself, a speech pathologist, and it could be one of a variety of different evaluations. There could be the clinical assessment of something called a modified barium swallow, or a fiberoptic endoscopic evaluation of swallowing. So the clinical assessment is what we call subjective. We're gathering information from you, we're testing the muscles of your mouth and throat, we're looking at how fast you swallow, we're looking for any of those signs of aspiration. We're determining whether or not we think there may be a problem there, and if you need more diagnostic testing. The way I talk about the difference between the clinical evaluation and the objective evaluation, the pictures that we take later, is kind of, say you went to the doctor and you said, I think my arm is broken. What does the doctor do? X-rays, yeah. The doctor doesn't just say, oh, okay, and put a cast on it and treat you. The doctor wants more information, wants more diagnostic information. So that's where some of our objective tools come in. So these are tools that we use that where we can actually look at the muscles of your swallowing directly. We can diagnose, are you having a problem? If so, how severe is the problem? We can diagnose that silent aspiration. If it's going down the wrong way, we can actually see it, and we can see that you're not coughing. We can determine a plan for, okay, what's wrong, and how do we help you and make it better? And then we can refer you to specialists if doctors are needed or other evaluation is needed to help you, more outside our scope of helping. So the modified barium swallow procedure, it's an x-ray test. You're seated in a chair. All the food is mixed with barium. We give you different thicknesses of food, and we just take a moving x-ray picture when you swallow. And what's nice is that it's real time, so we can actually see where it goes, and if it's going down the wrong way, we can try to help fix it during the actual test. So this was supposed to be a moving image. I apologize. I wanted to give you an example of the modified barium swallow, but this is the x-ray test, and this is the part that we're looking at again, the side view of your throat. So the fiberoptic, this is another objective test. The fiberoptic endoscopic evaluation of swallowing, also called a FEES. Person, you're seated in a chair, not an x-ray, it's just in our office. We give you different thicknesses of food. Again, this time it's just mixed with food coloring so that we can see it in your throat. There's no barium, no x-ray taken. We put a little camera, it's a little tube with a camera on it, into your nose. We stop in your throat, and then we actually watch you swallow. And we can determine how the muscles are moving, again, if there's silent aspiration, and how to fix it if we do see a problem with it. Okay, so this is, I don't know how well you can see this. This is an image of the second test, the fiberoptic endoscopic evaluation of swallowing. So I have a little camera, it's a little tube with a camera in a person's throat, and this is actually your voice box here, that's the epiglottis. And as I proceed, so here is your voice box down in here. And that's the part of your body that moves to make sound, but it's also the part of the body that when you swallow protects your air pipe when you swallow, so that food and liquid doesn't go down the wrong way. So I give a person a different thickness of food. You can see some food coloring in there, and then we look to see if there's any evidence of it going down the wrong way. So just one example. Now, Lee Fakir here has undergone both tests. You had both, didn't you?
Yes.
What did you think of the two?
It was painless. I thought that it would be more painless. More painful, but yeah. It was painful. I thought it was it was quick.
It was quick. Some people have one test, some people have another test, some people have both. It depends on what your symptoms are and some of your medical history to determine which one is appropriate and whether or not you need both. Good question.
Is your nose anesthetized?
I don't do that. I don't anesthetize in my facility due to medical reasons. That's an actual drug and medication that you're putting on someone. So to avoid any type of risk of complications, I don't anesthetize. And I've actually had it performed on myself without the anesthesia, and it's uncomfortable. You feel a lot of pressure in your nose, but it's not painful, and it shouldn't be painful. If it's painful, there's something wrong. So, and I use the pediatric scope. It's a little tiny one versus the adult, so it's a little more comfortable. So for therapy, what would we do in therapy? We would determine an individualized treatment program of exercises to help you specifically to what we saw in the evaluations. We may use tools that can also increase the movement of your muscles more so than you're able to do by just thinking about it. We have something called electrical stimulation. Has anyone heard of that before? Okay, so it's these little electrodes you put on your parts of your body. They use it a lot in occupational therapy for hand movements, say if someone suffered a stroke. And so it sends signals to the brain to flex the muscles more so than you could do just thinking about it. And then we perform exercises while the electrodes are in place here in your throat. We focus on exercises to increase the coordination, how fast you swallow, increase your sensation so that you're able to feel stimuli better, you're able to feel the food, the liquid better in your throat. And then obviously we educate you and your family members as far as swallowing exercises for home, changes in your diet, aspiration precautions, all of that. We want you to have as much information that will help you. So treatment, sometimes what treatment involves are different postural changes in your body. During the test, those objective tests I told you about, if we're seeing a problem, we may try some different techniques during the test to find a way to make the food and liquid go down the right pipe. Sometimes they involve postural changes, which means tucking your chin, turning your head. Sometimes it involves maneuvers, such as swallowing, squeezing your throat real tight, and then relaxing. So we'll try different maneuvers during those tests if we do see a problem in order to keep you on a normal diet, thin liquids, not having to change the diet at all, in order to swallow more safely. Sometimes it's simple things like teaching you to slow down, take smaller bites, avoid using straws. Sometimes they're very easy changes. Sometimes it's a little bit more involved with changing the texture of your food. Having food that's chopped up finer or thickening the liquids a little bit to help it go down safely and to not put you at risk for those complications of aspiration that I talked about earlier. Does anyone know anyone who's ever been on what we call modified diet, thickened liquids, change the texture of the food, puree? Yeah. So aspiration precautions, what can you do in the meantime just to ensure you and your family are safe when you swallow? Make sure you're always sitting up nice and straight and tall when you eat and drink. Don't lie back in bed or on a chair on the couch and eat and drink. Eat when people are only fully awake and alert. Minimize distractions if you think someone's having a swallowing problem. Turn off the TV, turn off the radio. Focus on the actual meal itself. Take your time, eat slowly. Look for any signs of infection, productive cough, fevers, chest congestion. If you notice those things, let your doctor know right away. They may like to evaluate you. And then learn CPR and the Heimlich maneuver just to be on the safe side. Hopefully you'll never have to use them, but it's always good to have that information and that knowledge. Questions?
The Heimlich maneuver, is that complicated?
Not so much, no.
What would you say were the principal no-nos or things to not do if you're doing the Heimlich maneuver?
Well, I'm not trained in teaching people the Heimlich.
Okay.
But that's what I'm saying. You want to seek specialty training in the Heimlich maneuver. Yes.
If the uvula involved in swallowing, or is that just there?
That's a great question. The uvula itself is not directly involved in swallowing, but the tissue above it and behind it in the throat is. What it does, the tissue, you have tissue that closes off the nose so that you don't have food or liquid coming through the nose when you swallow. So not the uvula, but the tissue that it's attached to does play an important role. And what, This presentation is about swallowing problems associated with post-polio syndrome. But we also see people who have changes in their voice. The voice either becomes weak, hoarse, sometimes it becomes what we call hyponasal, where the nasality of the voice changes, where you may sound as though you have a cold, but the quality of your voice changes, and that's something that we could work on in therapy as well. And that would involve that same area, that same tissue. Yes?
Is one of the symptoms for aspiration gasping?
Could be. Breathing, any changes in your breathing. Yes?
Should be going over anything about receiving or anything?
Well, the upper esophageal, yeah, that would be an issue when it comes to the fourth stage of the swallow, or the third. If you have a muscle at the top of your food pipe, which she's asking about, you actually have one at the top and one at the bottom. And the one at the top is supposed to open and relax to receive the food. That could be a place where you have tightness there and it's not opening and relaxing. So you could have food back up in the throat, so that would be an issue. And that's where the gastroenterologist or the ENT may come into play. Yep, good question.
Are there certain foods that seem to be troublesome for post-polio patients that
Well,
you
it's a
mentioned or that you've seen?
good question. When people ask, when the majority of the people we see, not necessarily post-polio, but just in general, tend to have more of a problem when it's a neurological cause for swallowing problems, meaning stroke, progressive neurological, Parkinson's disease, MS. A lot of times they have more trouble with liquids than solids. And if you think about that, the reason being is that, say you have a teaspoon of pudding and a teaspoon of water. You drop them on the floor. What happens to the pudding? Sticks together, kind of stays together. What happens to the water? Spreads out. That's your throat. So when you go to swallow, if your swallow is a little bit slow, which is common when we see in post-polio syndrome, that as you're swallowing the pudding, it'll stay together. You won't have so much trouble. It'll make it into the food pipe. But the water may break apart in the throat, and that's where you have that trouble. So some of it may go into the air pipe down the wrong way. Other questions? So, the most important thing to take away from this, if you feel as though you're having a swallowing problem, talk to your doctor, and then call us. We just need a prescription from your physician, and we try to assist you in obtaining that prescription too, which not all facilities do that, but we like to make the process as easy as possible for you. Yes?
I just want to mention something. What I thought was polio related for years, swallowing, etc., and I kind of ignored the choking and everything. And finally, I went to the ENT. He took a barium swallow.
Yep.
And found out that I had a pocket in my throat called a diverticulum. I had surgery twice for it.
Yep.
And I just wanted to let some people know that when they think it might be polio-related, it might be something else.
And that's a good example of structural that we diagnose as well as speech pathologists.
And I was just thinking, well, it's polio, I can't do anything, and I would turn my head and swallow, and I would try to do things that they told me to do. And first I had the invasive surgery.
Yep.
And it worked for about 9 months, and I started coughing again, so evidently, and I started doing the same thing. And then a year later, I had, where the outside surgery was
A lot of...
that was last year, and I'm doing fine.
That's great. What they usually do for that, what she's talking about is a Zenker's diverticulum is a little pocket that forms at the top of your food pipe due to the tightness in the top of the muscle at the top of the food pipe. Not necessarily polio-related, like you're saying, but what happens is the food collects there and it backs up into the throat.
I mean, a day later, you can be...
Yeah, and you can bring up food a day, 2 days later, that pocket. Sometimes you have a very foul odor, kind of unfortunately coming from your mouth.
I realize that, that
Could be
something done for that, and I have a new life now.
And often what they do is they go in and they just put a couple of stitches in there to close the pocket, and then it allows the food to go where it's supposed to go.
At first, I think they cut the pocket, through the invasive way. But for some reason, whatever happened, and then he just sewed the pocket up there.
Okay.
So.
I'm glad that you're feeling better. That's the important part.
Yeah.
It's great that you went to someone, had it diagnosed properly, and had it fixed. So,
But otherwise, I probably would have just thought it was polio-related, and it's not always everything is polio.
But what a quality of life change, I would think.
Oh, absolutely.
Yeah. To me, that's the most important part about the swallow.
Oh, yeah.
Could you repeat the name of that?
The
That
Zenkers,
condition.
Zenkers,
Yes,
Zenkers, diverticulum. Yes.
I have a craving for children ice cubes.
What about the
I
ice cream?
have
I'm
a
sorry.
craving for children ice cubes.
Okay.
Now, is there a hazard
Only if you
doing that?
have metal fillings, because it would probably hurt. I can't do anything about metal
Can it
fillings.
cause a deficiency in iron?
I don't know, I'm not a physician, I can't say that as far as the ice and the iron relationship, I don't know what that is. That's a good question for your doctor. I don't know of a link, but has anyone ever said that to you
Well,
before?
I went online with that.
Okay. Ask your doctor, yeah, it's a good question. Do you do it all day
I
long?
love them.
Well, what people don't realize is that everyone needs to be hydrated and drink water, but you can actually drink too much water. So that's another condition that's not related to what I do, but yes,
Well, I get dry now.
you do.
Okay.
Have you ever heard of Biotine?
Yeah,
Have you tried it?
yeah.
Have you tried the gum? There's sprays, gum, all that type of
Not
thing.
gum.
Try the gum. It might make a difference, yeah.
With a lot of the choking and swallowing problems I get with, I went for cranial sacral.
Okay.
And my physiatrist has said something that I really believe dealing with us with post-polio, that we have an awful lot of tightening of the muscles. So that no matter what we do, if we don't on a continuous basis, learn how to do the different exercises to to untighten muscles. It seems to be an ongoing part of our life.
Okay. So you're given some relaxation techniques?
Absolutely, particularly with
Stretches.
TMJ, with the jaws and neck. And it's continuous, like if I don't do it for a day or two, it's so rigid. So, but with this post-polio, whatever the dynamics are, we seem to
Get that
tighten up and lock. Thank you.
And that's an important part too, is that when we set up a program, it's
Right.
something we expect you to continue. It's just part of your, like brushing your teeth
Right.
every day.
Is Zenker's easy to diagnose?
Yes, very easy. You just have to take a picture. And that's a good example of why you would choose a modified barium swallow over the fiberoptic exam. Is that the fiberoptic exam would give us an idea there might be a Zenker's. We wouldn't know for sure until we took the x-ray picture. So we could do both for different reasons, but as far as diagnosing something like that, yeah. Yes?
Just comment. I was diagnosed with polio when I was 13, and I'm actually healthier than I was when I was a kid. But recently I noticed swallowing problems, and I went to various people and it's impossible. You can't have PPS.
Well, hopefully, Lee, you don't mind me saying this,
No,
but
absolutely.
so Lee and I met a couple of years, 2 years ago? Okay. And what was interesting when we met is you came to me saying, I have this problem, and you're talking about your conference and how a physician had been talking about swallowing problems. And the fact that I knew about it and I had seen other patients who came to me with the same symptoms, you were very surprised by that because...
Oh, right, yeah. And my biggest complaint, and I'm sure that the same people here, and I didn't know, I thought I was very unique. One of the examples that you used earlier is you're at a restaurant, and all of a sudden, saliva goes the wrong way. You cause a scene because you start coughing, and then the only way you can actually stop is by holding your breath, all right, for a while, and then it eventually stops. And that's when I went to see Jennifer, and as it turned out, was the exercises helped me a lot. Not only with that problem, but also with sleeping. I also I'm still not sleeping well, but I was sleeping a lot better, which I think Jennifer was a little bit surprised at, but then you've done some research and you said that.
That there's a relationship between obstructive sleep apnea, and it's shown, there's proven evidence that the oral motor exercises actually improve your breathing quality. So, yeah. So it's a nice outcome for
Oh,
both.
absolutely, yeah. So I urge, for anyone who has this problem, and if you're in Somerset County or any other, hospital that's there, if you're in Somerset Medical Center, by all means, go see Jennifer, and it will really help you.
I've been going to Central State. They have wonderful programs.
Good, good.
But I'm not familiar with PBS.
Yeah.
They wanted to send me to various neurologists thinking I had a stroke. And
Okay.
anyway,
And you may want, you have the references here, you may want to reference them, give them that Barbara Stoney's article. She is one of our gurus in speech pathology. And that's, a very nice article, comprehensive about swallowing problems in with the post-polio syndrome.
Thank you.
Thank you, Jennifer. Anything that